Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes and metabolism. Question number 2. For the following case, which of the following is most likely contributing to this patient's current glycemic disturbances? A. Decreased hepatic glucose production. B. Decreased renal insulin clearance. C. Increased pancreatic insulin secretion. D. Increased renal glucose excretion. E. Increased tissue insulin sensitivity. The case scenario is: a 36-year-old man with type 1 diabetes mellitus comes to the office due to recurrent hypoglycemic episodes. He previously had difficulty controlling his high blood glucose levels, but over the past several weeks his blood glucose has intermittently dropped to less than 50 mg per deciliter with accompanying symptoms of tremulousness and headache. There have been no recent changes in his diet, activity level, insulin dosage, or other medical therapy. The patient's other medical conditions include chronic kidney disease from diabetic nephropathy. His estimated glomerular filtration rate has declined to 20 ml per minute in recent months, and he is under consideration for initiation of hemodialysis. Physical examination findings are unchanged from the previous office visit 3 months ago. The question is: which of the following is most likely contributing to this patient's current glycemic disturbances? Your options are: A. Decreased hepatic glucose production. B. Decreased renal insulin clearance. C. Increased pancreatic insulin secretion. D. Increased renal glucose excretion. E. Increased tissue insulin sensitivity. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is decreased renal insulin clearance. This question is designed with the focus to assess your ability to apply foundational science concepts. Insulin is a peptide hormone that has both renal and hepatic clearance. Degradation of circulating insulin in the kidneys is dependent on an adequate glomerular filtration rate, GFR, which allows for delivery of insulin to the proximal tubule cells where it is broken down. Chronic kidney disease, CKD, causes decreased GFR, which impairs insulin clearance. In patients with normal pancreatic function, hypoglycemia is avoided because pancreatic insulin production decreases and circulating insulin levels rapidly return to baseline. However, patients taking exogenous insulin are at increased risk of hypoglycemia if there is no decrease in dosage to compensate for renal failure. In light of this patient's worsening CKD, his symptomatic hypoglycemia is likely due to reduced renal insulin clearance and a prolonged insulin effect. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. Decreased hepatic glucose production. Advanced CKD leads to reduced gluconeogenesis in the kidney, not the liver. Hepatic gluconeogenesis is inhibited by inflammatory cytokine release, for example, sepsis, heavy alcohol use, and beta blockers. C. Increased pancreatic insulin secretion. Patients with type 1 diabetes typically have minimal to no secretory reserve and cannot increase insulin in response to physiologic stimuli. D. Increased renal glucose excretion. Increased renal glucose excretion can cause glucosuria, however, this occurs in the setting of significant hyperglycemia, not hypoglycemia. In addition, this patient's low glomerular filtration rate would be expected to reduce renal glucose excretion. E. Increased tissue insulin sensitivity. Insulin sensitivity is decreased, not increased, in CKD due to the accumulation of urea and other metabolic toxins. Your take-home message from this question is that insulin has both renal and hepatic clearance. In patients with advanced chronic kidney disease and diabetes mellitus, decreased renal clearance of insulin can lead to symptomatic hypoglycemia if exogenous insulin doses are not adjusted based on the change in renal function. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.